Hello, everyone. We have a very special topic today. How is acupuncture and epigenetics correlated? I mean, an amazing topic right now, because all of us want to get our genes tested and see, oh, what are we going to get? So we have a special guest, Dr. Kristina Santos. She is a licensed acupuncturist, a massage therapist, and an aerial yoga instructor. Whatever that means, Dr. Kristina, I'm going to ask you that. Welcome.
Thank you so much for having me, Amita. It's a pleasure being with you.
So let's talk about acupuncture and epigenetics, the correlation.
Absolutely. So, I definitely want to explain to people a little bit about the differences between TCM, what we know as traditional Chinese medicine now, and the classical acupuncture, because there are definitely differences. Traditional Chinese medicine, as we know it today in modern day, is really the reformed way of practicing acupuncture. During the 1950s, during the reign of the Mao Zedong, they have basically restructured the way traditional Chinese medicine is practiced today. So it's a little more evidence-based, it's a little more westernized, right? And the classical way of practicing acupuncture is going deeper into the deeper levels of a human being, where we take into account, and even in traditional Chinese medicine, we do take into account, obviously, the emotional aspects of a human being. But with classical acupuncture, we really go into the level of the spirit and the DNA as well. So when I talk about classical acupuncture, my expertise is working with the 8 extraordinary meridians, right? I think most people are familiar with like the 12 primary meridians, meaning the lung channel, the large intestine channel, stomach channel, spleen channel. And those are amazing channels to treat specific issues, right? Digestive issues, skin issues, even fertility, right? You've had guests who have talked about those topics. However, when we talk about epigenetics, I honestly was not exposed to that knowledge until later in my schooling through acupuncture. And when one of my teachers who was practicing specifically classical acupuncture in the 8 extraordinary meridians explained how gene expression actually can be changed, right? And so the field of epigenetics, comes from Greek, so it means on top. So epigenetics doesn't really change the nucleotide sequence of our DNA. It just changes the superficial expression of our genes. So the way I like to relate it is, let's say you may be a carrier of a BRCA gene, right? BRCA gene for breast cancer, correct? We know that that is passed on through genetics. Now, what interested me in this topic of epigenetics is seeing that some people can be carriers of certain genes, but those genes don't get expressed. While others, they can be carriers and they don't get expressed, other people get expressed. So what is the difference, right? So with classical acupuncture, because we look at the person's lifestyle, the person's thoughts, the person's diet, what does the person think about the universe and how we come to be on this planet? I don't want it to sound woo-woo in any way, but we have to consider the person as a whole, right? Yes, we're made up of this flesh, but what is flesh made of, right? We're looking at the atom. We're looking at the deeper structures of our nucleus, and within the nucleus is the DNA. And so classical acupuncture taps into the deepest layer of a person's energy field. And so when we look at different levels of energies from a classical Chinese medical perspective, there's a superficial layer, the Wei Qi, right? Our protective layer. Then there's the middle layer, the Ying Qi, which is the level of the blood. And then there is a deeper level, the Yuan Qi, which is our source Qi. And that is the essence that we're born with, right? We're born with a certain amount of essence, which is called Jing essence in Chinese. And this is something that's given to us prenatally, right? In utero.
Mhm.
And unfortunately, through our life, as we're living life and thinking and eating all kinds of foods, that jing actually diminishes,
Mhm.
right?
Mhm.
And so that's not something that we can replenish, unfortunately. However, through certain practices and also through classical acupuncture,
Mhm.
we can keep those levels more stable, right?
Mhm.
And so going back to the expression of, let's say, a cancer carrying gene, we want to look at obviously the analysis of the DNA. So I know you said you were interested, maybe like all these new DNA companies that are coming out, and seeing what people may be predisposed, so people know how to address it before a disease is expressed. So that's really like the juice where I like to work with people. Does that make sense?
Yeah. So, okay, so let me just ask you. So, I understand the classical acupuncture difference between the traditional Chinese medicine. So, and so now let's just talk a little bit. Like you think, and you said that classical acupuncture can go deeper, right, and into our bodies because it's more involved. It's more kind of going into the root part of our bodies. So, do you still think that the users like myself we'll have to get like a gene testing done from one of the companies, like so many companies out there, and then come to you, or I come to you and then, like, how does this work?
It is helpful. I have to say it is helpful because I've also studied some functional medicine just because some people like things to be a little more tangible, something a little more like proof, a physical proof. So in those ways, I do recommend getting tested just so we can have a record of like, hey, these are the potentialities, right? You may be a carrier of specific potential expressions of diseases, but if we know that in the first place, then we can address it. If you come to me, we will still do an intake. We will still get to all the questions to see who you are as a person. What were some health issues that you may have had in the past? We obviously ask about family, right? Family diseases. And so if we see that in a patient's chart that their family is a carrier of specific diseases or potential for those diseases to be expressed, I don't even need the DNA tests. I know that I need to work on a deeper level. And especially if I notice that the person is, depressed, or they have high anxiety, or their lifestyle is just not conducive to healing, a deeper level of healing, then I can really go deep and address all of the aspects. And something that's very specific to classical acupuncture is that the treatments are longer. It takes 40 minutes for the jing essence to get mobilized, right? For the body to even register that we're going to that deeper level of energy, as opposed to traditional Chinese medicine where we treating maybe like the 12 primary meridians. Those treatments are 25 to 30 minutes tops. So yeah, those are the big differences as well.
So, okay, so let's just talk about a classical acupuncture because that's where the gene formulation and all that thing is happening. So explain us, I mean, I've used acupuncture very regularly. I regularly go to take care of a lot of things that happen to me. And it's amazing. So explain us a little bit, like acupuncture, typical acupuncture session involves inserting the needles. So what is that different in classical acupuncture? Like, are you including other things like moxibustion, cupping? I mean, what is the difference? What is the difference here?
Absolutely. So I'll explain. So I mentioned it's 8 meridians, right? They're called 8 extraordinary meridians. And why they're extraordinary is because each of the meridians deals with different issues, okay? They are developed, some of these 8 meridians are developed in utero, and some of them developed as we go through life, okay? Unlike the primary channels, we're born with them. We have them, they're in our body, they're in our energy field. the 8 extraordinary meridians also develop throughout life. And so in the cycles of 7 for females, born females, and 8 for males, or 10 according to different books, so cycles of 10 years. So when we look at a person's life progression, we kind of look at those cycles. What were the big things that happen in a patient's or person's life that could have triggered specific imbalances in their energetic field? And once that energetic field shifted, then we obviously see the shift in the physical body as well, and then diseases express themselves. So with classical acupuncture and the 8 extraordinary meridians, some channels require gua sha. Gua sha is scraping. We have to address specific musculature on the body in order for treatment to begin. Other channels require cupping. Moxibustion is performed on specific points and only specific amount of moxibustion. So it's almost like formulas. It's very precise. It's very specific. There is intuition involved. Always, I feel, just because of the nature of the medicine, but it is very, very particular. And depending on who you study with, Jeffrey Yuen, one of like the top classical acupuncturist, he teaches specificity, right? 40-minute retention time from the first needle insertion. There is a lot of visualization happening while the patient is on the table. So I guide the patients to visualize the points while they're on the table, visualizing light entering these points, visualizing the points being connected on the trajectory of the channel. So I have to say it is easier for people who are more visual, right, to see these things happening in the mental plane. And then what I like to do is I like to give people homework, right? Because yes, you can come in, you can have an amazing session, but with the 8 extraordinary meridians, the treatments are a minimum of 3 months because it takes 100 days for Jing essence to fully change its pathway according to the classics. Now, I feel like it's really hard to study these things like randomized controlled trials. So that's why we're not seeing so much research done on the 8 extraordinary meridians. But I feel like the more practitioners are exposed to this type of knowledge, we will be seeing more and more studies coming out about this as well.
That's what I was going to ask you, that is there a research that says that 8 meridians that you're talking about, the acupuncture, classical acupuncture, can actually change the gene expression, right? And and that's what I was really trying to get to, the next level. So you're saying still there is a research that needs to happen. There are more randomized control trials that need to happen, right? Right now, there's some studies or individual studies, in your opinion, that are
right now, I'm not seeing anything on the 8 extraordinary channels. I think because you know, the knowledge that's coming from China, they're moving more towards a westernized style of practice. That's why the herbal formulas are so integrated with the acupuncture as well. But I have a feeling, because of the work that I've been doing with people, I do it in a program basis, right? We have to work together for 12 sessions in that period of 3 months for the person to actually see the change on a deeper level. And the changes that I've seen with my patients are the changes in behavior, changes in attitude, changes just in the way they approach life. And they tell me these changes are super subtle. Very, very subtle. But after the 3 months and then 4 months, and they see changes in their life, they're like, wow, I just finished a relationship that wasn't serving me. I got a new job, right? We can treat physical ailments, obviously, because we're talking about epigenetics and gene expression. I've treated people with fibrocystic breasts, right? We've treated people with polycystic ovary syndrome. gender issues, all of these things are actually related to our genetics, right? And so when people tell me about their issues, I'm like, ah, okay, we need to go deep into these channels. That's how these channels work, right? That's how we change the epigenetic expression. However, epigenetics, the nature of it is that it's not permanent changes, right? And so we have to really change ourselves in the long run to see these changes stay with us. Because if we go back to our old ways of behavior, outdated patterns, inevitably, I feel we will revert back and disease can come back, right?
So from what I'm understanding is a 3-month program using acupuncture, classical acupuncture, the most of the changes that you see is in the behavior, right? And these are subtle behaviors. So there's no like in the sense, like what I'm trying to understand is there some kind of a test that's being done to really understand now the gene expression has changed? And that doesn't look like that we do that. We just look at the behavioral changes, right? That's my
correct. Yeah. And if you combine, for instance, and I know you've had functional medicine practitioner as guests, I think it's a great complement. The two modalities are so good together. If we take functional lab tests,
yes,
I think it is easier to actually see these changes than if we just go to regular tests at your healthcare practitioner's office, because those ranges do not show you the deeper changes.
And
right?
That's what my point is. I think I think it's a fascinating topic. How acupuncture can, classical acupuncture for that matter, can affect the gene expression. But I think it would be more credible if there is a functional lab testing that is involved at the beginning and at the end, right? So that way, there is black and white data that's driven to make like, okay, acupuncture and epigenetics is a correlation.
Absolutely. You are so correct. And actually, that's something that I'm working on right now, is to slowly start to integrate both into my practice. I live in New York City, unfortunately and fortunately, because functional lab testing can be a little bit restrictive in the state of New York. But as far as the bigger aspect of the United States, I think people are definitely able to get those labs done. And I think it is paving the way to a new healthcare system, integrating both functional lab testing and acupuncture to truly see those changes, like you said, to give it more credibility, because I think it's credible, but unfortunately, without hard data, how can we prove it, right?
Yes.
That's pretty much the key, is doing the exams before, the tests before, and then after a certain period. I would say probably 6 months would be a good amount of time to see those changes stay even past the 3-month period.
Sure. Well, thank you so much, Dr. Kristina, for sharing with us classical acupuncture, how classical acupuncture is different than traditional Chinese medicine. And Dr. Kristina is working on building some evidence as far as correlation of classical acupuncture and epigenetics. The data is still out there right now, but it needs a little bit more research and data. But there is enough data to prove, in the sense, like the classical acupuncture definitely helps, and it's a preventive medicine and helps with a lot of other issues, right?
Absolutely. Absolutely. Thank you so much for having me, Amita.
Thank you. Bye-bye.
Bye.